y'all. I'm Dr. Martha Durham here in Greenville, South Carolina. I'm a psychologist, and this is another episode of Why Did They Do That, the podcast. And I'm really excited to be here with Natasha Compton, who is a licensed massage therapist. She's my massage therapist and has been for 12 years. Is that right? How many years?
So, yeah. Since 2014,
okay.
2013.
Okay.
Yeah.
No mathing. No mathing. Y'all can add it up.
Long time.
Right? And so our topic today is, why do people sexualize massage? And I don't know if you saw this, because I think you were away on a birthday trip.
Oh, yeah. Mm-hmm.
While you were gone, 2 massage parlors near my house were busted for prostitution. Mm-hmm. And that's exactly what we're talking about, right?
Yep.
So tell me why you think that occurs.
Well, it's been a problem for a long time, and there are multiple reasons for it. But currently, it has a lot to do with sex trafficking.
Yeah.
A lot of these massage parlors
Yep.
are fronts for sex trafficking, and it's a big problem in the health field like mine.
Yes.
Because it damages our credibility and our integrity as a
Exactly.
healthcare professional.
Which you are.
Right. So I'm just here to try to separate the two.
Yeah, for
And
sure.
It's not talked about a lot.
Yeah.
And it needs to be.
Well, that's why I thought it was so important for you to come on. So one of the things I will say about your profession and you is you have helped me and my family and my friends and my neighbors. I send everybody to Natasha. And the reason is there's something medical, magical, I don't know how else to say that. You know how to help heal bodies. Like, I have had injuries. I remember falling and damaging, I think, the ligament here, which I didn't know. I just knew that I was in pain. Mm-hmm. And I would come to you and you said, okay, there's not a lot of blood flow there. You have to actually massage and do things there to help the healing happen. You actually said, you're not going to feel 100% for a year. All of that happened.
Yeah.
So tell me about that. Like, how do you know that stuff?
I've specialized a lot in pain management.
Yep.
So I've taken a lot of courses and learned a lot about medical massage over the years.
Yes.
And it can be really empowering for me and the client to educate them.
Yes.
Because unfortunately, I see a lot in my field where therapists just kind of go in and do what it calls a foo-foo massage, which
Yes.
there is credibility to that. There are benefits to that. But the client isn't always getting education on what's going on in their body and why. Mm-hmm. And part of what I like to do is try to educate people so that they understand their body better, so that they can better take care of it at home, not just come into me forever and ever to put a Band-Aid on it. I try to help them figure out what's going on, the root cause of what's going on, so that we can heal it. And if it's not something that is soft tissue, which is what my expertise is in, then I will recommend them. If it's a structural thing, I'll recommend them to a chiropractor. If it's something else, other alternative therapies that might be able to, physical therapy, acupuncture, things that can help them to heal.
Their medical doctor, if it's even something
I've
like
had
that.
them. I've suggested people go get X-rays and CT scans and things like that. Because if I'm not able to help, then I want them to find someone that can.
Yes. So getting back to this idea of massage being thought of and treated differently than it should be, so sexualized, you have a license, you have education. A part of that education is learning all this anatomical and physiological stuff.
Yes.
Like, you actually know what you're talking about. Y'all should be throwing out some words where she knows the body parts, the muscles, how they connect. Your job is serious.
Yes.
And you help people recover. There's nothing worse than chronic pain.
Right.
So when you have this other industry that really is taking what you do and sexualizing it, I mean, that's terrible.
Yeah.
Have you heard stories? Have you had anything happen to you? I know you have. Tell us a little bit about that.
It's rampant in my profession. I've heard countless stories over the years of women being sexually assaulted, sexually harassed.
Massage therapists.
Massage therapists, yes. And I've had some things happen myself. And if for women who are younger or just starting out, that don't always have the best boundaries,
Right.
it's hard for them to advocate for themselves.
Yeah.
And so these things can perpetuate and get worse. I have a story of someone who came in and was trying to get massage, and being able to recognize red flags early on is the best thing. And thankfully I have really strong boundaries.
You do.
So
she didn't always, because I've known you a long time.
Yeah,
they were
it's developed over
fine,
the
but
years.
now they're a lot stronger.
Right.
Yeah.
When I first started out, it was harder for me to hold those boundaries. But
Well, you were young.
Yeah. I was in my early 20s when I first started. So had a guy came in, and he first time in for therapy at my office, he starts to undress before I leave the room.
Right.
And I had to very quickly say, I'm sorry, please wait till I leave the room to undress.
Right.
And he said, okay, and didn't have any problems after that. So I was like, okay, I kept it mentally checked. And saw him several times. Things fell off, but he never actually said or did anything that was out of the way. So I let it continue until he texted me out of the blue and asked if I would do a special massage for him at his house. And I immediately...
Did he just say special, or did he describe some special massage?
That he worded it in a way that was suggestive, but not direct.
Yes.
And this is common. Predators will start small and test their boundaries.
That's grooming. Yeah.
And so I immediately shut it down. And
of
was
course.
like, I'm a professional. This is not what I do.
That actually makes me feel anxious, and it would make anybody in that position. And unfortunately, a lot of times that's women. We get in that position sometimes. And I feel anxiety for you.
Yeah.
Yeah.
It's a really hard position to be put in.
Yeah.
And kind of makes me angry sometimes too.
Yeah.
Like, how do you put me in this position in the first place?
Yeah.
And undermine my integrity.
Correct.
But I shut it down, and he immediately was like, oh, that's not what I meant. And I said, oh, well, please enlighten me. I would love to understand what you meant. And it was radio silence.
Yeah. And so you never saw him again, did you?
No, I didn't allow him back. There was a time later where... So I have some automated emails that send out to clients if they haven't been in a while.
Oh, Lord, don't you hate that stuff?
I didn't think about shutting that off for him. And he got an email, and he's like, does this mean I can come back? I was like, no.
Sorry, mistake.
No. And I immediately went and corrected things, but didn't have a problem with him after that. He didn't harass me or anything.
That's super scary. I remember something from when you first moved in with us. I convinced Natasha to share space. And so she's a part of our practice here. We're all our own businesses, but she works with us like as a roommate here. And I remember at another location, at the very beginning, you were much younger. I remember it was a Saturday, because you used to work Saturday hours, and you were going to be the only person in the office. And I remember us texting, and you were saying, somebody here that's coming in makes me feel funny. And I remember driving and sitting in the office. Do you remember that?
At North Main Street?
Yes.
Oh, yes.
I sat in the office so that you would feel safe. And I think he didn't come back, whoever that was. But do you remember that situation?
If it's the one I'm seeing, there's several.
Yeah.
If it's the one I'm remembering correctly, it was a man who I didn't remember at the time I had seen before at a different location. Yeah. And he would come in, and he would only pay cash. Yeah. He would only give business information. Yes. There was all these little red flags. And on the table, he would try to get me to take the sheets off. Yeah. In which a lot of people might not know this, but in the state of South Carolina, in most states, it is required to be draped. Yeah. Makes sense. So I let him know. I was like, I'm sorry. Yeah. This is required. Yeah. And he kept saying he was hot. Yeah. And it's like, I can uncover your feet. I can do little things to try. I can turn a fan on, but I cannot uncover you. And he continued to try to scrunch those sheets up until the only thing that was covered was right here around his genitals. And thankfully, it didn't go further than that. Yeah. There was a time where I shut a massage down because of that. Like mid-massage. Yeah. It was the same person. So it was the first, again, I didn't remember him the second time
I'm not judging you. I'm mad at him.
It was years later that
oh.
he came in at our office.
Got you.
I didn't remember him at the time, but the first time he came, I shut down the massage a little, like 3/4 of the way through, because of the things he kept making comments, and he kept trying to uncover himself. And so I shut him down, and he asked, well, why did we end so early? And I let him know.
Yeah.
And thankfully I worked for a lovely boss.
Yes.
And I told her what happened, and she didn't allow him back.
Yeah, that's awesome.
Yeah.
There's some other things. I want to go back to this idea of human trafficking, because, the people in that situation, the males and females who are probably forced into that situation of a sexual massage, or what they call a happy ending, y'all. And it's sad that everybody knows that term. That's how common it is.
Yeah.
Those people, I feel like, are not at fault. It's the people who are trafficking them. Mm-hmm. So I don't want to harm those people. I want them not to be in that position.
Exactly.
Right?
Right.
And like I said, it's really close to us. Like, it's happening in Greenville. It happens
all over Greenville.
And you really have to make sure you know where you're going. Mm-hmm. Hopefully the people who go in there who know where they're going, hopefully they get in trouble. You don't just want the poor person being trafficked to get in trouble. You want the person who's trafficking them to get in trouble, and maybe the people utilizing those services, and maybe that's how it stops. Right. And
unfortunately, it's really hard to actually bust these places.
Right.
But when they do, there's been a few recently, thankfully. But they set right back up.
Yeah.
It's a cycle.
Yeah. They know how to get around the laws. Regulation, there can be over-regulation, but some regulation really matters. And in a field like yours, we do need licensure, regulation. Yes. We need the board to be serious and have enough investigators to look at this stuff. Yeah. For my business, it's very important, but for your business, it's super important.
Yes. And I do believe that South Carolina in particular are starting to make efforts to do better in the licensing field, and making sure that the professionals are actually licensed and professional. But that we still have a long way to go.
Yeah. So there's this other thing that I think causes the sexualization of massage, and maybe even in my profession, like people having bad boundaries, and it's the media and television and movies.
Yes.
Like for our profession,
porn industry.
Yes. But if you ever see a movie or a TV show where a therapist falls in love with their client or has an inappropriate relationship with their client, this is so terrible. This should not happen. That person shouldn't have a license. Well, the same thing has happened in your profession. Yes. There's a television show or something, or a series. What's it called?
It was called The Client List.
Yes.
With, I think it's Jennifer Love Hewitt.
Yep.
And the premise of the show was this woman that had children and needed a job, and she went to this massage parlor.
Yes.
And without a license or anything, got a job as a massage therapist, and very quickly learned that it wasn't just a massage studio. So she starts doing things for clients, and they try to
romanticizes it, which is terrible.
And they romanticize it, and they try to show that she actually cares about these men, and a lot of them just want someone to talk to, and these kinds of things. And so they blur the lines between prostitution or sex work and massage therapy. Yeah. And nothing against sex work. The problem is it's not legal. Right. There are some states that it's legal.
That's correct.
Like you said, if you're not coerced, and that is something that you choose to do, no judgment.
You're grown.
But
it's legal.
They also don't try to blur the lines between massage therapy and sex work.
Right.
They're very clearly a sex worker.
Yeah, I'm a sex worker. So that would be like in Nevada. I think it's in this country. There's probably some other states. In the Netherlands. Holland, Amsterdam, I think it's legal. And I think it's really regulated so that hopefully they're not being coerced. I still wonder. But anyway. Yeah. So I get what you're saying. If you're choosing it actively, you're not being trafficked by someone. That's your gig. Right. Consenting adults, whatever.
Right.
I'm going to bring up one other thing. And I think this is a tiny percentage of the population of massage therapists. But occasionally there's a massage therapist who isn't doing their job right.
Correct.
And it's somebody with a license, we think, because I know in this town, I'm going to try to be really vague because I don't want to get sued for one thing and unfairly talk about someone. But I remember being in a couples massage. So my husband's on one table, I'm on one table. I had a male massage therapist. He had a female massage therapist. It's just the way it worked out. And the massage therapist, without educating me or talking to me about what he was doing, started to do massage that went in my inner thighs way too close. And I'm a very direct and confident person. And I froze. I was so uncomfortable. It was the worst massage of my life. He did not go further than that, but it was terrible.
Yeah.
And I remember telling my husband afterwards, I don't know why I didn't say, what are you doing? Stop doing that. I'm uncomfortable.
Right.
And I think we talked about it before, and you're like, he probably just needed to educate you.
Right.
Right? Because there are times when I have a sciatic problem and your job is to take your elbow and put it in the middle of my butt cheek like you do with the tennis ball, and that relieves the pain. But you say, here's what I'm about to do, here's why, and I'm like, go for it, girl. Right? So maybe he just needed to educate me, but it felt bad.
Right. And that can be a problem in the field too. I see where a lot of people are turned off to massage therapy when the licensed therapist is a professional, and they mean no harm. Yeah. But they don't get consent, and they don't talk to the client before they're about to do something. Yes. And so that can make someone, especially if someone has sexual trauma in their past. Yes. Even if they haven't. Yes. And they don't have great boundaries, or this is a very vulnerable position you're in. You are naked on the table, even though you're covered. You are naked on the table, and some people might not understand that they are in control. Yeah. Because I make sure to let my clients know, this is your session. You are in control of anything that happens. If at any point there's something that you are not okay with, that you're uncomfortable with, that you don't like, speak up immediately. Yeah. And I think that's helped me over the years to make clients comfortable with me, because anytime I'm going to be in an area that might even possibly be uncomfortable, I educate them on why I want to do this and how it's going to help, and if they're okay with that first. Yeah.
I'm so glad that you brought up sexual assault victims. I have sent people to you for the very reason that they need to learn about touch and be okay with it. Yes. And you've known and they've known. Yes. And I'm sure that's a completely different process where you're talking them through everything.
Absolutely.
Yeah, but that can be such an important part of someone healing from bad things that happen to them with touch. But it's so important to know that maybe someone just shows up for a massage. They don't know they're going to get triggered because they had something happen in their past. So you have to, educate for that reason. You don't know what's happened to somebody. Right. Any other thoughts about the sexualization of massage therapy?
I just really, I really appreciate you having me on today and having a conversation about it, because I think that it's not talked about enough. Right. And I think there should be more conversations about this. Especially me loving the field that I'm in, and wanting to educate people more on the benefits of how much it can help, and seeing so many people get their lives back. Oh, yeah. I don't want people to be deterred from massage by the things they've heard or bad experiences they've had in the past. And it's just an ongoing issue. Yeah. I can't tell you how much Natasha has helped my family, helped my friends, helped my clients, my neighbors. There are things that, like, I don't have pain anymore where I was in constant pain. We know that I have a sciatic problem. It never gets bad anymore because you deal with it. I come in every other week. To me, it's such an important self-care. And I have an athletic son. It's been amazing for him. Yes. It's just so important. So I really hope people will understand massage is almost a medical thing. Yeah, you can have the relaxation part, but it is so important that we have to make sure that we don't sexualize it and cheapen it. Right. And just really be sure that you know where you're going and that you're going to a licensed professional. Yes. Thank you so much for coming and talking to me today. I appreciate it.
Y'all, this is the Why Did They Do That podcast. If you liked what you heard, subscribe, like, pass it on. Thanks.